皆さんこんにちは、ハンガリー学生のゆうきです。今日は実は4年生になって新しく研究を始めてて、その研究発表を英語で初めて行うという日でめちゃくちゃ緊張してるんですけど、これからこのカメラに収めていきたいなと思います。やっぱりアメリカに将来行くっていう上で研究っていうのはやっぱ絶対に外せなくて、リサーチをどんだけしたかとかどんだけ発表したかっていうのがアメリカの就職病院で働くためには必須で、その第一歩と思って、今回はこのがっつり研究というよりかはちっちゃめの研究で教授に向かって発表するというところで、自分の大学以外からのいろんなハンガリーとかヨーロッパの教授が集まった中でプレゼンをして、彼らからの質問を受けてそれに答えていくという、研究人生の第一歩的なところなので、これをちょっとカメラに収めていきたいなと思います。で、英語のプレゼンについては結構やっぱり苦しんで、教授に言われたのは、やっぱ日本人ってもともとプレッシャーかかるものとか緊張してビクビクしちゃうものみたいな、プレゼンイコールみたいなのっていうイメージがもともと持っちゃってるんじゃないかなみたいなことを言われてるんだけど、彼らの意見ってみんなの目をで10分間なんだけど、今日はみんなの目を10分間自分に集められて、その中でプレゼンができる、こんなに楽しいことないんじゃないかっていうような考え方をしてて、全力で楽しめよみたいなことを言ってもらって、確かにそうだなと思って、みんなの注目、みんなの時間を10分もらって、自分のプレゼンを見てもらってアドバイスくれて質問をくれる、こんないい時間ないかなって思うんで、僕自身はもう全力で今日楽しんで最高のパフォーマンスを出してこようと思いますんで、ぜひ楽しみにしてみてください。
Today I will present about my research titled Relation between gait changes and muscle weakness following knee surgery. This study was conducted with the Department of Traumatology and Orthopedics and under the supervision of the Dr. Krohal. Let's begin. The background of this study is, according to European Society of Traumatology and knee surgery and arthroscopy, the number of the patients for ACL injury is increased in recent days. Also, there is a similar trend in the US. Also, what happened in these days, the right picture. At the same time, many research reported the changes of the gait and body composition even after successful procedure. So research why I took this topic in this time. As I mentioned, many studies show about changes of the gait and the body composition such as muscle mass after knee surgery. They mostly focus range of the motion, step length, and pain parameters. However, there is limited data about post-peak or compensation of the rotation movement and each phase of the gait. So in this study, I would like to focus these parameters. So in this slide, I would like to explain briefly about how surgery causes altered gait and long-term consequences. So as we know, surgery leads to biomechanical changes such as muscle weakness, joint instability, and pain or fear of the movement. Those three causes finally contribute to altered gait. For a long time, altered gait causes limit of the motion, for example, reduced balance, asymmetric loading, and compensatory patterns. These three factors are clinically important because even small asymmetry, small reduced balance cause knee injuries, especially for athletes. So in this study, I hypothesized that examining muscle weakness and joint instability contribute to chronological and force-related gait changes. For method, we completed measuring of the gait and body composition for 34 patients. After applying exclusion criteria such as BMI, age, or neuromuscular programs, we analyzed 20 patients, 10 for post-operative patients, which is 4 months after the operation, and 10 for healthy individuals. In this study, we measure about physically active people as a healthy individual. For the method, we use the Zephyrs post-distribution measurement treadmill analysis, because which is the gold standard system for dynamic pressure monitoring system. So as we can see a picture here. Under the bed of the treadmill, there's a pressure sensor which catches each post distribution. And there's a camera behind the patient which catches all the gait of the patient. For the body composition, we use in-body because which is non-invasive and safe measurement for post-operative patient. So here is a real measurement for us. So patients walking on the treadmill, there's a camera behind the patient which catches all the gait, all the phases of the gait, and special program analyze all the data parameters of the gait on the PDF file, so which we can see white picture here. And for the in-body, we ask the patient to take off the clothes as much as they can, and we measure each muscle mass on the left side and the right side. So in this study, we focus the lower limb, muscle mass of the lower limb on the left side and right side. We compare the difference. So before the result, I would like to explain briefly the phases of the gait. So mainly we have 2 phases for each leg. And for the stance phase, the foot on the ground, which is divided into 3 phases. The beginning, we have load response phase. So load response phase is responsible for loading of the body weight of the leg after heel strikes. After this phase, we have single limb support, which is one leg is holding all of the body weight to one leg. After this phase, we have pre-swing phase before swing phase, which is preparation of the swing. So we measure all the phases of the patient and compare the operated knee and healthy knee. Interestingly, we only found the difference on the load response phase, and operated knee showed us the prolonged this phase compared to healthy knee, but it was not significant statistically. But which means patient has a cautious heel strikes for operated knee and slow body acceptance to the operated knee. For the other phases, such as pre-swing phase, we didn't find any difference. And for the rotation, also we didn't find any difference in this study. But however, interestingly, we found significant reduced force on the maximum force phase 1, which is during heel strikes. The operated knee showed significant reduced force compared to healthy knee, which means the patient has the fear of the pain or less confident on the heel strikes. For the maximum force 2 is for total, the pushing of the ground of the patient. The operated knee showed slightly reduced force of this maximum force, but it was not significant difference. For the in-body, we compared the muscle mass of the left side and right side. But interestingly, we didn't find any difference between operated and healthy knee. So all the patient finished the rehab, so which might be the reason for that. So we did the t-test for all the parameters in this study, and we found significantly reduced maximum force on the phase 1, so very heel strikes, and slightly prolonged load response phase. In conclusion, according to this study, the patient had prolonged load response phase and significantly reduced maximum force on the phase 1. So which shows the patient has more affected on the extension movement of the joint by surgery than flexion movement. So which indicate the need for rehab to emphasize the quadriceps training and make a confident on this phase of the patient. So further studies, we should assess a patient immediately after the surgery to see the time point result, compare the time point result to see how the recovery process and therapy effect. Also, in this study, we only got 10 patients for each group. So I would like to try to find more patients and I will keep this research. This is our contribution. Thank you for your attention.
Thank you very much. I will give you the certificate of attendance. And I appreciate the presentation, and I would like to ask the audience about the questions. And the board members, please.
Congratulations, very nice talk. And my question is that the key point in the ACL reconstruction is the recovery of the proprioception. All the other is not so important. So have you any idea that these differences maybe have some connection with the proprioception recovery? Can we measure it somehow? Because that would be really, bright future for the sports people.
Thank you for your question. This is my opinion. The proprioception is affected, the recovery of proprioception is affected by patient confidence, try to have more, they get better. This is my opinion. So I cannot say any exact parameter right now, but I would like to try this research in the future as well. Maybe, probably we can ask patient confident how fear of the movement or chronologically changing of that.
Thank you.
Congratulations, you were here on the first presentation. I had a question then that was now I hope the answer will be in your talk, because this is really the title is that the relationship between the gait change and muscle weakness. In the conclusion, I don't understand now. Please try to tell me what is the relationship after all.
Thank you for your question. In the title shows muscle weakness and joint instability. So we try to find the muscle, the difference, the muscle mass on the operating side, healthy side, after 4 months later of operation. But unfortunately, we couldn't find the difference between
I saw only one parameter.
So, yes. So in this study, only one parameter.
Okay.